So is the way we fund the NHS through UK taxes the right way to provide healthcare? Dr. Bob Gill, let me come to you. I mean, you feel so strongly about this that you even made a film about the NHS, didn't you? Tell us where your politics lie on this issue.
Yeah, well, you know, it was about 10 years ago I started noticing a political agenda to privatise the NHS, and from that point I started to look into the whole matter. As a practising doctor, I also noticed that the system was starting to malfunction. After a good period of funding in the NHS, I was finding the care and waiting lists were starting to creep up. And then I found out about the Health and Care Bill 2012, which in law actually abolished one of the founding principles of the NHS, and that is the Secretary of State's duty to provide health care. So the legal basis for the NHS was significantly undermined. And I
without much noise about that, really. Did that sort of go under the radar a little bit?
Absolutely under the radar. So it was dressed up as putting control in frontline hands, but that was not what happened. The NHS was broken up into structures based on the American insurance model. And we've just had gone through Parliament in July another Health and Care Act, which actually completes the transition to an American-style system of managed care. So, you know, the discussion about funding is important, but what we must realise is the point we are at now has taken 30 to 40 years to get us to, because our political class do not dare be honest with us that their intention is not to serve the public interest, but to turn the NHS into a corporate cash cow. And that's where we are now. Very fortunately for government policy, they've been hiding a lot of their reforms behind the pandemic. Everything is down to the pandemic. But we know before the pandemic struck, waiting lists were growing. The NHS was relatively defunded for a decade. The workforce suffered a 20 to 30% real terms pay cut. We had Brexit, which scared off European health workers. We had a 2016 industrial action. Junior doctors were warning, if you keep attacking our terms and conditions, you're not going to have a workforce. And guess where we are? And you covered in your piece at the introduction, we've lost half the beds in the UK. We have one of the lowest bed counts in Europe. There simply isn't enough beds or staff to provide care.
It's a bleak start, Bob, isn't it?
Yeah, but the key thing about funding, if I may just finish this point, the money isn't going to provide healthcare. A lot of the money is going to service private finance initiative debt, which was a scam to transfer ownership of hospitals to the private sector, which has happened. Alongside that, saw a contraction of bed capacity. For every new hospital built, it had a third less beds. So you had a covert bed closure programme, as well as a transfer of ownership over to the private sector. And we are now servicing the debt with NHS budgets. The marketisation of healthcare is sucking at least 10% of the budget into administration. And we've also got more and more outsourcing. So the money is not going to direct patient care. It's being siphoned off by private interests.
Wow. Matthew Lesh, let me come to you. Now, you're the head of public policy at the Institute of Economic Affairs. What Bob has just described there is privatisation by stealth.
I mean, quite frankly, what Bob has just described there is a fantasy. There is no truth to the claim that there's this evil, nefarious plan to privatise the NHS. We know that the amount of outsourcing in the NHS has remained below 10%, it was like 7, 8, 9%. It hasn't really changed in the last decade. There's no grand plan to privatise the NHS. In fact, more funding generally goes to GPs who actually aren't technically part of the NHS. We completely lose track here of a serious and adult debate about the NHS when we just throw out ridiculous claims. There is no interest in the political class of fundamentally taking away people's healthcare. There's no interest in introducing a US-style healthcare system. Even me, who disagrees with much of the political debate and says maybe we should look at other systems, we don't tend to look at the US. We look at the extremely successful healthcare systems in Germany, in Australia, in France. Now, let me tell you, in France, that socialist republic, they have 95% of people that have private health insurance, and that's in addition to a socialised healthcare system that delivers healthcare very practically for all. In Germany, they have a system of social insurance, also extremely effective. Now, there are other models and there are other ways. I'm sure we're going to get into this in more detail to fund the NHS, but I just want to get this fundamental point down. The NHS is not broken because of this idea that it's being privatised. It's broken because it's a highly bureaucratic, centrally controlled, inefficient system that takes more and more money. It hasn't been defunded. If funding were the issue, the NHS would be a massive success. We're looking at something like 40% more funding since 2010 by 2025. The money in the NHS goes up and up, and yet the quality of healthcare we get goes down and down. So it clearly isn't a problem about money. It's a problem about structures and design and the very nature of the system and the monopolistic, very state-driven system that the UK has chosen and is very far from the envy of the world.
Bob, I must let you come back in.
Sure, well, I'm not being paid by anybody to say what I'm saying. Matthew is from the Institute of Economic Affairs. This is a lobby group. It is a pro-privatisation lobby group. By transparency organisations, it's been described as very secretive in terms of its funding. We do know that companies, big tobacco companies, alcohol...
I'm sorry, you're going to get to the matter of this debate, or are you going to...
And sugar companies fund the IEA. Now, this is not the qualification you need for people giving advice about how to run a health system. He also disparages what I just said, but he fails to understand that we've had passage of successive legislation, all of which marketises the NHS, and he keeps distracting us to the European model. But the people leading the change here, for the last 7 years, the chief executive of the NHS was a Mr. Simon Stevens, who was formerly head of United Health, America's biggest private insurer, and he was head of global expansion, and he made successive reforms to replicate the American managed care system. So Matthew might attack me, but he cannot challenge me on the facts. We had a Health and Care Act just gone through Parliament, which has created what are called integrated care systems, but these are modelled on American managed care.
OK. I didn't hear a personal attack, to be fair. What I heard him question was a potential conflict of interest from your organisation, as opposed to a particular slight against you. So go on, respond.
Well, I think the implication there is that I'm corrupt and don't really believe what I'm saying. Now, I have no particular interest, financial interest in the UK's health system. I have an interest of an individual who sees a broken healthcare system that sees tens of thousands of more people die from conditions in the UK compared to comparable healthcare systems in the US. And then I see this completely nonsense debate about this conspiracy theory. Yes, there have been various restructures of the NHS. No one's going to deny that fact. That doesn't mean that there's a conspiracy to privatise the NHS or to get rid of universal healthcare or to introduce an American system. That is clearly not the intent. That is not the structure. That is not what is going on here. And we can't have a serious debate about the NHS if we get distracted by this sideshow made-up universe about things that aren't happening.
So you just made something up yourself. You said compared to other countries, we were poorly performing. America spends twice as much GDP per head than this country. It has a lower life expectancy. It has worse maternal mortality. It has a higher infant mortality. So compared to the American system, we are doing much better given the money we are spending. And despite all the siphoning off that consecutive legislation has enabled...
Look, again, there is no siphoning off the private sector. The amount of outsourcing in the NHS hasn't changed. Secondly, to your point, are you going to let me finish my point?
Have you heard of market?
Are you going to let me finish my point?
So have you heard of these things?
So what I'm doing, and this is we always get this, we compare to the American system, but we don't... What I was comparing to was the European systems that spend similar amounts... they spend similar amounts to the UK, more or less. Some spend a little bit more, some spend a little bit less, but they get much better outcomes.
Okay.
And as the NHS, as the Guardian famously reported on the King study into the comparative healthcare systems, the NHS does very well in every metric except for keeping people alive. The truth is, the NHS doesn't work effectively compared to comparable systems. Let's not talk about the US. I'm not interested in talking about the US because that's not what this is.
Because you want to avoid the direction of travel.
Listen, by the end of this show, we might have solved this problem. So stay with us. We've got two very big, passionate brains here on this topic. And don't forget, I want to know what you think as well. GBViews at gbnews.uk. I think what we all agree on is it's not working properly. We've got too many people dying too quickly. We've got too many people having bad care and not enough compassionate care. The question is, how do we fund it? That's what we're talking about tonight if you're just tuning in.